Good morning to you and to all those who tune in to watch or listen to this media briefing every morning. We will provide an update of the latest events in Cuba and around the world regarding the COVID-19 pandemic. And we will also address some questions, concerns raised by the media and also by the people who write to us asking for clarification on some aspects, even technical aspects. First, let's refer to the international situation. For some days now, the number of nations reporting cases of COVID-19 has remained the same, 182. Nearly 2 million people have been infected. There is a total of 1,734,913 confirmed cases worldwide, 81,709 more than the day before. That's the number of confirmed cases in a single day. Still, the numbers of deaths are more shocking, 6,104 in just one day, bringing the total number of deaths to 108,192 for a mortality rate of 6.2% of the total of infected people. 179 countries report community transmissions, representing 98.3% of the total. The region of the Americas also reports increased number of confirmed cases. In all, 614,674 cases, representing 35.4% of the total reported worldwide, including 23,826 deaths, for a mortality rate of 3.9%. Regarding Cuba, yesterday we welcomed 4 travelers coming from abroad, all of them members of a flight crew. The number of non-residents who are still here is 12,474 people, 5,409 of them foreigners, and 7,064 Cuban residing abroad. The number of foreigners in rental homes is 969, most of them in eastern Santiago de Cuba and also in the Havana municipalities of Plaza de la Revolución, Centro Habana, and Playa. There are currently 2,305 people hospitalized. 143 are under surveillance. As you can see, the number of people under surveillance is diminishing. Many of these people are travelers coming from abroad. Upon arriving, they were transferred directly from the airport to some assistance centers, where they were placed on a 14-day quarantine. However, some people are still under surveillance, and the number will increase again gradually, as we place other people who we consider at-risk groups under surveillance. In Cuba, there are currently 1,580 suspected cases and 582 confirmed cases. A total of 8,360 people are being kept under surveillance in primary health care. Yesterday, we have been doing for 5 consecutive days now, we again analyzed more than 1,000 samples in a single day. These are PCR tests, real-time molecular biology diagnostic tests for COVID-19. A total of 2,076 samples were studied yesterday. We aim to continue increasing the number of tests performed every day, taking into account the large number of asymptomatic patients, people who are infected with the virus but show no symptoms and who are spreading the virus. Of the total of 2,076 samples analyzed yesterday, the vast majority, 1,066, were analyzed at the laboratory of the Tropical Medicine Institute, followed by 376 in the Molecular Biology Laboratory in Santiago de Cuba, 255 in Villa Clara, 186 in Havana, and 193 samples were analyzed in the laboratory of the National Civil Defense Council. Of the total of 2,076 tests performed yesterday, 57 turned out to be positive, representing 2.7%, similar to the rate of previous days. People have also expressed a concern regarding this ever-increasing figure. To those, I say that it is only logical as the number of performed tests is also increasing. It is an indication also that there are still people in our country who are infected with the virus. Cuba accumulates a total of 17,133 samples analyzed, 726 of which have turned out to be positive, representing 4.2%. Of the 57 new confirmed cases, 56 are Cuban nationals, and there is also one foreigner coming from Bolivia. In one case, the source of the virus was traced abroad. In Spain, 49 were contacts of cases that were previously confirmed here in our country, and in the remaining 7 cases, the source of the virus is unknown. We continue tracing the source of the virus so as to detect other people who may well be infected out there. But I repeat, at this point, the source of the virus in those 7 cases is unknown. Of the total of the 57 new confirmed cases, 35 are female patients, representing 61.4%. The majority of new confirmed cases reported yesterday were male patients. Today, women represent the majority, while male patients account for 38.5% of the total of the new confirmed cases. 63.1% of the total of new confirmed cases were asymptomatic. They were showing no symptoms of the disease. They were tested not because they were showing symptoms, but because they were either in a risk group or were contacts of previously confirmed cases of other people who are under surveillance. If they weren't tested, they would be in their respective communities, posing a threat to themselves, to their health, and to others, as they would be spreading the virus and infecting other people. That is why we insist on the importance of complying with the control measures. Sometimes people don't quite understand why they are being placed under surveillance when they are showing no symptoms. They admit that they were contact of a previously confirmed case, but since they are showing no symptoms, they don't consider isolation measure to be necessary. I call attention here to the large number of patients, confirmed cases, who were totally asymptomatic. The age groups most affected are people under 40 with 17 cases and people between the ages of 40 and 60, with a total of 14 new confirmed cases representing 29.8% and 24.5% respectively. The provinces with the largest numbers of confirmed cases over the past 24 hours are in that order: Holguín with 17 cases, Havana with 15, Villa Clara and the Special Municipality of the Isle of Youth, 8 each. Of the total of 726 confirmed cases reported in Cuba thus far, 568 are progressing favorably. Cuba reports 21 deaths. Today, we are reporting 3 more deaths. As we've reported in previous days, 2 patients have been evacuated for their countries of origin. A total of 121 patients recovered and have been discharged from hospital. 29 more over the past 24 hours. These patients, as I said, progressed favorably. Once they complete their 14 days of hospitalization, they are again tested for COVID-19, and if negative, they are discharged from hospital and sent back to their home, where they observe 14 more days of isolation under surveillance with restrictions of movement for further confirmation. And let me clarify this: only people who were confirmed cases, those who at some point tested positive for the virus, are required to observe 14 more days of isolation in their homes after being discharged from hospital. Those who never tested positive are not required to observe another 14 days in isolation. Regarding the patients reported as being in critical and serious condition, we have 7 critical and 7 serious. There is 1 patient who yesterday was reported in critical condition but has improved and is now reported as being in serious condition. He is at the Luis Diaz Soto Hospital. We have 2 more patients who have developed some complications and have now been added to the list of those reported in serious condition. Both of them are at the military hospital in Holguin province. Regarding the 3 deceased patients, 2 of them had been reported in critical condition for some days now, and the third is a woman who developed several complications. About the 7 patients in critical condition, we can say that one is between the ages of 40 and 49. Another one is between the ages of 50 and 59. 3 are between the ages of 60 and 69. And one is between the ages of 70 and 79. And the other was between the age group of 80 and 89. Summarizing, 5 of the 7 patients reported in critical conditions are over 60. These are people in at-risk population groups due to their age. Of these 7 patients in critical condition, one is at the military hospital in Villa Clara, another one is here at the Luis Diaz Soto Hospital, one is at the Pedro Curie Tropical Medicine Institute, 3 are at the Salvador Allende Hospital, and the other one is at the military hospital in Santiago de Cuba province. Regarding their provinces of origin, one is from Villa Clara, 5 are from Havana, and the other is from Santiago de Cuba. About the pre-existing conditions of these patients, 3 suffer from hypertension, 4 have diabetes, 1 suffers from adrenal insufficiency, 1 has chronic kidney failure, another one has chronic obstructive pulmonary disease, and another one has bladder neoplasm. As you can see, these patients have pre-existing conditions which further complicate their recovery. Regarding the patients in serious conditions, 4 are between the ages of 50 and 59, 2 are between the ages of 60 and 69, and the other one is 80 in the age group of 80 or over. As you see, again, these patients' ages constitute a risk factor. Of this, one is at the military hospital in Villa Clara province, another one is at the Luis Diaz Soto Hospital here in Havana, 2 are at the Salvador Allende Hospital, 1 is hospitalized in the Isle of Youth, another one is at the military hospital in Camagüey province, and the other is at the Fermín Valdés Domínguez Military Hospital in Holguin province. 1 of the patients is from Villa Clara, 3 are from Havana, 1 is from the Isle of Youth, 1 is from Ciego de Ávila, and the other one is from Holguin. About their pre-existing conditions, 3 suffer from ischemic cardiomyopathy, 4 have hypertension, 1 has diabetes, and another one suffers from chronic kidney failure. I forgot to mention that of the 57 new confirmed cases that we are reporting today, 15 are from Havana. The municipalities of Centro Habana and 10 de Octubre have 3 each. Plaza de la Revolución and Cerro report 2 each. Habana del Este, La Lisa, Marianao, Arroyo Naranjo, Abolleros report 1 new confirmed case each. 1 of the new confirmed cases is from Matanzas province from the municipality with the same name. 8 are from Villa Clara province, 4 from Manicaragua and Camajuaní, Santo Domingo, Santa Clara, and Placetas, with 1 new confirmed case each. Ciego de Ávila province reports 1 new confirmed case in the municipality of Morón. Camagüey province also reports 1 new confirmed case in the municipality with the same name. Holguin province reports 17 new cases distributed as follows: 11 from the municipality of Banes, 3 from Holguin municipality, 2 from Jibara, and 1 from Cacocú. Santiago de Cuba province reports 3 new confirmed cases, all from the municipality with the same name. Guantanamo province has 3 new confirmed cases from the municipality of Baracoa, and the special municipality of the Isle of Youth reports 8 new confirmed cases of COVID-19 over the last 24 hours. As we said before, we are today reporting 3 more deaths. 1 of them is a male Cuban patient, 62 years of age, from Matanzas province. He suffered from hypertension. He was showing symptoms of the disease and developed some complications. He was at the military hospital in Matanzas province. For several days, he had been reported as critical, and unfortunately, yesterday he developed a severe respiratory distress and hemodynamic instability. The other male patient who died yesterday is a Cuban citizen, 83, who resided in Spain. He arrived here in early March. He was hospitalized at the Pedro Curie Tropical Medicine Institute. Among his pre-existing conditions, he suffered from chronic obstructive pulmonary disease. He was in his 19th day of hospitalization, 14 of them in intensive care unit. Doctors did everything they could, but unfortunately, yesterday he developed multiple organ failure and died. The third patient who died over the last 24 hours is a Cuban woman. She was 75 years of age from the municipality of Cacocún in Holguín province. She suffered from hypertension, and since late March she was showing respiratory symptoms. She was diagnosed with the disease and was hospitalized. And yesterday she developed severe respiratory distress and died in the military hospital of that province of Holguín. Again, doctors did everything they could, and they followed the protocols and applied all the established treatments, but she developed some serious complications and died. Before taking some questions, I would like to address a couple of things that our population has been asking. One has to do with the period of contagiousness of the disease, which is the period from the moment one person gets infected with a pathogenic agent, which is the virus, and for how long that person spreads the virus. As in this case, as we have been reiterating, this is a disease that was not known to the world. It is a new one. Its features are now being described, and at this point, there are different opinions. It is stated that after showing the first symptoms, that is, during the incubation period, there are people who are already spreading the virus. This is why the period of spreading the disease begins before the moment in which the patient starts showing the first symptoms. When is that? Well, that answer is not well defined. Now, once that the person has acquired the virus and is diagnosed, how long does that person has the capacity to spread the virus? The practice is to keep the person in isolation and hospitalized, firstly to attend to the patient's health and to avoid complications, and secondly to avoid that that person spreads the virus. The person is not discharged as long as she or he does not test negative to the virus through a real-time PCR test. The person returns to the community to stay another 2 weeks in isolation, at a moment in which presumably he or she no longer transmits the disease. This additional isolation is in the house under the observation of the family doctor in the community, and it is to make sure that the patient has fully recovered. In this period, the patient does not leave the house nor receive visits, and this is something we want our people to understand. The other question asked is related to the possibility of a person getting the disease again. We have seen reports from around the world of people who have tested negative, then afterward they have tested positive again. And this makes people have doubts. I was going over some literature on this regard and could not find a definite conclusion on if the virus remains dormant in that person's system, in a particular organ of his body, or later it comes out again, or if that person got reinfected in the community. This is not well established. This morning I watched a report with Professor Vivian Curie from the Pedro Curie Institute for Tropical Medicine, which delved into immunology. There are diseases that get the patient immune for life. If a person suffered from measles or mumps or rubella, that person gets enough antibodies and become immune to those diseases for life. There are other illnesses that do not do that. Take, for example, dengue fever. It has 3 serotypes and it does not leave you immune. You may suffer from a disease, including a respiratory illness like this. And we have the case of the flu. People ask why there is a yearly shot against the flu. And this is because you do not become immune after having had that disease, and not even with the vaccine. So these are the aspects that has to do with the contagiousness, with the way this disease is spread. We recommend that if a case is confirmed, we apply the protocol we have and we implement the protection for a while.
Caso confirmado, todo el protocolo que tenemos y siempre una protección durante un periodo de tiempo. La otra pregunta.
Now, turning to a question that I gave a reply yesterday on the people who have the human immunodeficiency virus, HIV, as they are immunocompromised, and their defenses are low, they are susceptible to acquire the disease and develop its most severe symptoms.
La profesora Marisela Lantero, que saben ustedes que es la jefa de este programa en nuestro ministerio.
Professor Marisela Lantero, who, as you know, is the chief of the HIV program in Cuba, this morning, with good reason, she clarified to me that for HIV patients, they are treated with antiretrovirals. If the patient adheres to the treatment, and his viral load substantially decreases, so this person compares to any other person who is not HIV positive and whose defense is similar. So she told me that it was important to state that HIV carriers are not more susceptible or less susceptible to get the disease like anybody else. If the HIV patient is following the treatment appropriately with the antiretroviral at the time of fighting COVID-19, the patient has the same possibilities of success as a person who is not HIV positive.